Well, as we wrap up coverage of this year's World AIDS Day, we want to take a closer look at HIV in Somalia and South Africa. Africa 54's Ndimyake Mwakalyelye joins us now. Ndimi?
Well, thank you, Vincent. Yes, World AIDS Day was marked and observed around the world yesterday, December 1st. In Somalia now, many there living with HIV are often subjected to stigma and discrimination because the mostly conservative Muslim society associates the disease still with promiscuity. Now, people living with HIV often have to stay anonymous and receive free monthly testing from Banadir Hospital in Mogadishu, which gets its funding from local and international aid groups, including the Global Fund to fight AIDS, malaria and tuberculosis. The Somali government says it has no money to assist and is calling on the Global Fund to scale up funding.
The Somali government does not have the capacity to handle the needs of HIV/AIDS positive people due to lack of funds. We are, however, trying to manage with what we get from the Global AIDS Fund.
Now, Banadir Hospital officials say the money is needed for awareness campaigns in addition to treatment and counseling. The exact number of people living with the disease in Somalia is unknown, but officials say close to 1% of the country's 9 million people have HIV. Moving to South Africa now, where the latest research shows that efforts to reduce new HIV infections among young South African teens is working. But the bad news is that the girls between the ages of 15 to 24 are 3 times more likely than boys to contract the virus. Thuso Khumalo has more for VOA News in Johannesburg.
The South African government says more people are getting tested for HIV, thanks in part to a government campaign that urges get wise, get tested, get circumcised. President Jacob Zuma himself led the call in 2010 when he was publicly tested for HIV and revealed negative results. United Nations figures show that South Africa still has more than 6 million people living with HIV, but there is good news on new infections amongst teenagers. The Human Science Research Council of South Africa says HIV prevalence in youth between 15 to 24 years of age has dropped from just over 10 in 2005 to just over about 7% in 2012. Scott Bennett is Senior Executive Manager at Love Life, an organization working for a world without HIV. He says these positive numbers are the result of vigorous awareness campaigns over the past few years.
Sex is far more spoken about, condoms are generally available, and people are beginning to realize that open, honest and early discussions about sex and sexuality don't predispose young people towards risk, they actually help them to avoid risk.
But girls are more at risk than boys. UNICEF figures show HIV prevalence in girls is 13.6% compared to 4.5% for boys. The question is why? Matebu Homampane, a training specialist at Soul City, says the lack of relevant HIV awareness messages targeted to young girls is the problem.
Because sometimes you'll find that in the schools, people want to say abstain, abstain, when basically there's children in the same schools who are pregnant, there's condoms that are used lying around in the schools.
But 19-year-old Portia Mungwambe, a Love Life peer educator, says there are other pressures like poor girls getting lured by older men with gifts and cash and even food in exchange for sex.
Basically, we have the issue of sugar mummies and sugar daddies. You know, as teens, we want to fit into the lifestyles of having fancy things. For example, having my hair done, having those heels.
Portia says building self-esteem and confidence in young girls is part of the solution. She also has some straight talk for her peers.
Be safe, condomize, and do everything into your powers to protect yourself.
Portia says unless enough teenagers are trained to communicate such messages to kids their own age, it will be a long time before the rate of HIV prevalence among young girls comes down. Thuso Khumalo for VOA News, Johannesburg.
Well, joining us now via Skype from Durban, South Africa is Andrew Miti from the AIDS Foundation of South Africa. Thank you so much for joining us today, Mr. Miti.
Thank you for having me on.
So the report we just heard gives the good side and unfortunately still the bad side. So the message does have an impact when it works.
Most definitely, the message does have an impact. I think when it works and when it's reached the people it's intended for. But I think we have to remember that there's still a large proportion of the population in South Africa that aren't able to be reached with all the successful interventions that we have been able to implement.
Now, some of these other factors that were mentioned that are really still fueling the spread, you know, the influence and the impact of the elderly people, sugar mummies and daddies as they were referred to in the show. Really, is this a problem that is, would you say, the cause of this?
I think it's definitely a contributing factor. I mean, South Africa is a unique country in the sense that there's quite a lot of structural drivers that we're dealing with. I mean, gender-based violence has a huge influence. The consumption of alcohol, particularly by young people, is also having quite a large influence on their ability to determine safe sexual practices. And of course, against the backdrop of poverty, like the previous speakers mentioned, sometimes young girls face the pressures of trying to fit in within the society that they're in. And we have to remember also that we've got, in the new political dispensation, where we've got strategies to try and equitably distribute such aspects as education. The government has put in measures that sees, you know, young, deserving, academically deserving girls and boys from rural areas qualifying for bursaries and scholarships to come into the urban areas. But now, once they've arrived at a university in an urban area, they don't always have the financial resources to fit in with everybody else, which puts additional pressure for relationships with older men.
And of course, those in the rural areas remain disenfranchised and at the same time more at risk. But just, you know, as we move on from that, you know, the aim or the theme for this year's World AIDS Day was along the lines of bringing to zero the number of new infections by 2015. Is this likely for South Africa and Africa as a whole, given what you've just shared with us?
Well, I don't want to sound too down, but I think it is what it is. We've got a huge challenge ahead of us in terms of South Africa and the continent as a whole. So it's not so much as to whether or not we will actually bring it to zero by 2015, but I think about our commitment as a continent and as a country to actually work towards that. And I think for as long as we're working towards that, we're able to confidently believe that one day, and probably one day soon, we will achieve it. You know, sometimes they say aim for the sky, and hopefully, you know, you may just be able to hit the rooftop.
Well, we definitely hope you reach the rooftop. Thank you so much. Andrew Miti is with the AIDS Foundation of South Africa, and he joined us via Skype from Durban.